This presentation is called Being There for Our Patients with HIV. As a healthcare worker, you can be a hope builder in their life. When someone learns they have HIV, it is often one of the worst days of their life. Suddenly, no matter how young they are, there will be a pill that will keep them alive. They fear lovers and families may leave them or lash out at them at the point that they let them know of this disease. They may be overwhelmed by the financial aspects of the disease, especially if they're underinsured or not insured at all. Having the disease leaves them wondering if they will be seen through the stigma of the disease rather than for the unique and wonderful person they are. Healthcare workers who are afraid to treat them or are overusing personal protective equipment may give them the feelings that they are dirty or unclean. So how can you help? First, make sure the individual leaves the office with knowledge of support groups and counselors. Take the time to check with the patient and see how they're doing emotionally. Use PPE, but use appropriate PPE. You don't need to use too much, just what is effective for the situation. And offer information on financial assistance both for insurance and for medications.
I've always routinely had my HIV tests done, and it was always just very simple, but that day was very different. I just had a moment of just pure silence, like, did I just hear this correctly? Is this real? All I could just think about was my son and my mom and them not having to, bury me or anything like that. I finally made the decision that I was gonna live and just figure out how I can move forward. Catrice is son's mom turned best friend. I was glad that she was the first person I told.
It was a very emotional moment. You're somebody who's really, really close to me. I would do anything that I could to try to get him to know that you're gonna be okay and, we're gonna pick up from here and move forward.
And I love that the reaction was so affirming and so encouraging because at the time, I hadn't heard those words. Dr. Alopre, she helps me to manage HIV.
The Daniel that I met 4 years ago was sad and scared. I could feel the shame that he felt for his diagnosis. He kept telling me that he felt like he did something wrong. I kept trying to let him know that together we could get him to a point where he was undetectable and he had no virus in his blood, that he's not going to transmit that virus to anybody else, and he's going to have the life expectancy of somebody who's not infected with HIV.
I do realize there's a lot of people that won't get tested because of the stigma. They don't even want to be seen in the vicinity of a HIV clinic. And I get it. I totally understand because we live in the South and you worry about people talking about you negatively. If I had to tell somebody that would avoid getting tested or seeking treatment, I would just say, knowledge is power. Look at me. I've been dealing with this for 4 years. There's so much life you can still live.
The best way to determine if you have HIV is to go in and get tested. So be an advocate for yourself. 1 in 7 people living with HIV do not know that they are infected. The CDC currently recommends that all people between the ages of 13 to 64 get tested for HIV at least once in their lifetime.
I had to love myself with HIV. I had to love myself through every single mistake and say, though these things aren't what I would have hoped for myself, but I'm still giving life my best shot.
Can I get through this? Yes, I can. With support and with healthcare workers that care and opportunities to get the medicines I need. I hope you'll be a part of that in somebody else's life.